The central nervous system is the most fascinating, important, complex and vulnerable organ of our human body. It determines our entire being, who we are, what we do, and allows us to create and experience amazing things in life. Naturally, the brain is well protected from external threats by several highly functional barriers. But what if the brain gets affected by a disease like brain cancer, multiple sclerosis, Alzheimer, ALS, chronic pain? All are devastating diseases, and these diseases urgently need new and better treatment. That's why we use a Trojan horse to accomplish this.
There are many medications already made, and the brain has protected the neurons by a barrier in the blood vessels. It's called the blood-brain barrier. And all the medications that are there today, they don't simply get into the brain because that barrier keeps them out.
Is there a solution to get medicine into the brain?
So what we've used is an existing drug, and then we coated that drug with a compound that the brain needs. The brain needs an antioxidant to protect himself, and we coat that around the drug, and then suddenly it shuttles the drug in as well.
Well, does this method work with any medicine?
We can get many compounds in, but not all of them are easy to manufacture. So the more difficult the molecule is, the more complex it is to make a drug out of it. So we don't do everything. We do the ones that work and work predictively.
And how important is safety with this method?
Safety is a key question for all drug development, but especially for brain. And again, that's why we use a body-owned mechanism to get it in and not breaking down this barrier and using compounds that we know are safe or needed in the brain.
What are the results using this method?
So our first program that we are testing in patients with a deadly brain cancer. And it's a chemotherapy that we know that can work in the brain if you get enough of the chemotherapy in there. And that's a product that we make, and we test that now in patients, and we see them respond. Even patients that had 10, 12 prior treatments that all failed, they still have a response to our treatment. So that's a very promising development.
What does the future look like for this company?
Yeah, the future for this company looks quite good now, because we have two products that we know that our technology can handle, and now we need to find the very good combination with other medications to treat more brain diseases. And that's what our lab is doing and what we can do with our compounds.
And we are really proud at our researchers who are working for years at this project and now are bringing the results into real life.